Good afternoon, everyone. Welcome to our New Normal Guidelines webinar. We're very, very honored to have a great group of speakers and participants that we have been working with very diligently, and we are very delighted to welcome such a large group of hoteliers. And please keep in mind during, once we introduce everyone and they'll have a chance to talk, we also want to have a robust Q&A for our experts here with us. I'd like to also introduce our board chair, Valencia Tabini, who I know many of you know well, and she's the vice president. She has her job, besides being our chair, is she's the vice president of operations for MDM Hotel Group. So thank you, Florencia.
Thank you, Wendy. I hope you and your families are well. Thank you for participating in today's webinar, The New Normal. Last month, some of us were invited to take part of the Hospitality Task Force of Mayor Carlos Gimenez. We had the opportunity to work with medical experts, health department, staff members from Miami Dade, and industry experts to come up with the official guidelines to reopen our hotels. The idea of today's webinar is to discuss and share with you some of the topics included in the new guidelines. And for that, we have great speakers today and a great panel, including some of the members of the New Normal Task Force. So now back to you, Wendy, so we can continue.
Thank you. And now I'd like to introduce everyone. You all know Bill Talbert, our partner, our friend, and Bill beat me to the barbershop. So you're looking really great, Bill. And thanks so much for participating in so many of our initiatives and committees and task forces. And we just,
a virtual hug.
and I'd like to now introduce Shelley Fano, Executive Director of the Hospitality Institute at Miami Dade College. Thank you, Shelley, so much for being here with us. And we're very, very excited to introduce your training program. If you'd like to say a few words, please share some highlights of the training program.
Thank you, Wendy. Hello, colleagues. Hello, friends, team members that are watching, family. Virtual hug like Mr. Talbert does. Love it, love it. Thank you so much. We're so proud to be part of this initiative. The Hospitality Institute's been around since 2008, and it falls under the umbrella of our hospitality program at Miami-Dade College. The Institute has been doing work readiness training, and when this came about 8 weeks ago, our team got together and we immediately thought about infusing the guidelines from the CDC, OSHA, and the guidelines that were at that point. Now we have the mayor's guidelines, and we have aligned our curriculum with that. And the training that we will be doing will be training the lead trainers. So we're very, very excited about, and the training will include things like procedures related to safety and sanitation, social distancing, how to properly use and dispose of personal protective equipment. And prior to returning to work, whenever possible, we'll be doing the training at least 5 days before they go back. So we're very much looking forward to it and working closely with all the GMs and the HR directors. And we appreciate the opportunity to do this. Thank you, Wendy. Thank you, everybody.
Thank you so much, Shelley. Shelley, I've already gotten a few emails from some of our hoteliers on when will the training begin?
Well, we'd like to start the training as soon as we establish the schedule with the hotels. We're going to be working in small groups, and as soon as they give us the green light, we're ready to go.
Great. After this, the green light will be on. And then will you be training all hotel staff?
Wendy, we'll be training the lead trainers, and they in turn will be training their staff.
And then how long will the training take?
Our trainings are about 2 hours long, but we're going to give extra time for discussions, Q&A, and of course we're going to have follow-up consistently with the hotels as needed.
Wonderful, wonderful. And I'm sure there'll be some more questions for you too.
Sure. Thank you.
So now I'd like to introduce and thank, really from the bottom of our hearts, because I know you've been very, very busy, Juan Suarez from the Florida Department of Health. We really appreciate all the work that you've done, you know, not only with just our industry, but all other industries that are being really taken up as part of the new normal task forces. Thank you so much, Juan. And by the way, when this is all over, where our hotels are all open, we're going to treat you to a great hotel stay.
Well, hi everyone. I'm the regional environmental epidemiologist. I'm representing the Department of Health, the Florida Department of Health here in Miami. And I cover the region of Miami Dade and Monroe counties, from Key West all the way down to the Broward line. And my area of expertise is environmental epidemiology. So some of you may have seen me in your hotels doing investigations of Legionella, carbon monoxide, food and waterborne illnesses, things like that. But in this situation, I'm wearing a different hat. I'm going to be helping you to basically open your hotels and go back to this new normal that we're talking about, that it will be trying to go back to as normal as possible within certain constraints that we have to deal with to protect both your staff, which is very important, and your customers. So the health department is going to be assisting in this process by providing you with recommendations. So by assisting you in doing any type of investigation that it's required. In addition, we would like for you all to let us know. So we have approximately 150 epidemiologists here in Miami-Dade County working on this only. So you can imagine we're trying to make sure that that this process goes smoothly, and as we identify cases, we can do contact tracing and then try to remove the possibility of spreading to other people. So you know, we're going to be working closely with your facilities and many other facilities in Dade County to try to stop this spread of this virus and going back to a good economic situation for our county, which we need a lot.
That's wonderful. Thank you so much. And I'm sure we'll have more, we'll have questions for you throughout the program. We appreciate you taking the time. We know you're very, very busy. Now it gives me great pleasure to introduce Chris Rollins. Chris, you and I have done on a lot of webinars together. It's been really, it's been great working with you, and your participation on the task force was wonderful. Chris is the COO of South Beach Group and very, very, very active with us. So we're delighted to have you take the time.
Well, good afternoon, everybody. It's exciting to be here. I mean, look where we are. This is Miami and Miami Beach. You know, we have a lot to be proud of, and I'm thrilled and honored. So Wendy and Bill, thank you to the association and to the Bureau for all the things that you're doing, and to Juan as your organization. I know everyone is putting in countless hours to get past this awful thing that we're experiencing, and I think we're almost there. So thrilled to be here this afternoon. Whoever's watching, thank you for joining us, and let's have a nice meeting.
Thank you so much. And Jalissa Kepner, the general manager of the Miami Marriott Biscayne Bay. I feel like we've been together, right, since the beginning. Thank you also for all of your support. And I think I texted you like in the middle of the night at times, right, during this, after these task force meetings and everything. So really, really appreciate all that you're doing for us.
Thank you, Wendy, and thank you for your leadership and your commitment to help us, all hoteliers in our great Miami. I can attest for all those long days, long nights, and even weekend work, and you have been outstanding. A great advocate and a great voice for all of us in the industry, and we want to thank you for that. We, just as Chris said, we're very close. So I want to thank also Bill and the organization for the great support. I know we all very anxious as an operators, general managers would like to open yesterday, but we got to do it thoughtful, and we got to be also careful on how to open and make sure that we don't have relapse or anything like that. So we're excited to have here and looking forward to the questions and how we can brainstorm to be very successful industry during this pandemic.
Thank you again. And I'd also like to thank my team, Fahima Gazon, who handles all the marketing and the events, and Monica Walker. They've been really great. I've been bothering them a lot too. So we got to go to lunch soon. And I would like to thank Brian Lugnovic. Brian is like a second son to me. I've watched him work up the notches in a great hotel career. And he's now the VP of Hotel Operations for Robert Finbarb Company. He's very proud of you, Brian, and thank you so much for being such a great friend to us.
Thank you, Wendy. Thank you for your support through this pandemic and these very, very challenging times. And just glad to be a part of the team and hopefully look back at this moment a year from now and say we made it and we were able to pull through together as a community and as a team.
Thank you. So let's see now, what do we have? Do we have any questions? Okay, this is an interesting question that I have. Will hotels be allowed to open with 100% of its inventory for sale or restricted like the restaurants? You know, my response is there's no occupancy, there's no number, percentage of the hotels. I know that the restaurants have 50%, right, Bill? I think it's 50%, but we're allowed to open with 100% of its inventory for sale.
Wendy, the restaurants are 50% inside.
Yeah.
And as much as another 50% outside. So the restaurants at the end of the day, they work it out right, could have 100%.
And Wendy, I'll just like to add, there has been discussion, and it's just discussion at this point. Miami Beach is considering to reopen with a 50% cap on occupancy, but it's not 100% yet. But that's Miami Beach only. I haven't heard of any limits for the county.
Yeah. I was not aware of that.
Now, can I address that just a little? Because people say, well, it's one rule, what? The county, Mayor Gimenez's rulings, his orders, are a minimum standard. Any city could have a stricter ruling, but they can't have a lesser ruling. So it's a minimum standard, and it's the first I've heard of the beach having a number of rooms, but a city couldn't go below the minimum standard. So for instance, on the restaurants is an easy one. If the restaurant rule is 50%, a city could not go down to, well, they couldn't go to 100% inside, because that would be more liberal. You couldn't go that way. You could dial it down and say, you could have only 25%. So it's a quote minimum standard. I don't know if those are the right words, but that's how I understand how cities can make adjustments.
Thank you. Thanks, Shelley. I just sent you a question. Is there any safety certification connected to COVID-19 being developed?
There's a food safety certification. We're not doing that one at the time. We can do it, but that's not part of the training that we have right now. What we'll be issuing for Train the Trainers is a certificate of completion from Miami-Dade College. And I also would like to say, it was announced today that the medical campus is now going to offer 4-hour online training with no cost for contact tracing training.
Wow,
that's something that
That's
I think is really important.
That's very interesting. Yeah, we should get that information and send that out. Don't you all agree?
Oh, I agree. Get that to us, Shelley. That's wonderful.
Yeah, it's really great. That is really great. let's see. There's a mention of training requirements for hotels provided by Miami Dade College, that each hotel is required to have a lead trainer to take some kind of course to be certified with the Department of Health. Do you have more information on what the course will entail? Or do you know when we should expect more information about this? Perhaps this person I didn't hear your intro in the beginning, Shelley. Maybe you just want to go through that.
Sure. What we're providing is training that aligns with Mayor Gimenez's new normal guidelines. It's considered like a standardized training. Everybody will receive the same training, so it complies with what he has in his new normal guidelines.
Okay, great.
I hope that answers the question.
Only thing I would ask, Shelley, can you send that out to all of us so we can get it out to even more? I know you might have shared it, but we can share it every week as people are either coming back to work or things are, a little changing. So could we get that information?
Sure, absolutely.
Thank you.
Yeah, we'll send it out after this. Will there be a limit for how many trainers a hotel can have?
We haven't set any limits.
Yeah, we haven't said it.
We're here to serve.
Right. This can be a good message for any of the hoteliers. Is there a protocol for what the hotel should do if any guest reports that he tested positive COVID-19? I think Chris or Julissa or Brian probably can handle that, or Florencia.
Well,
I think we have it in our guide. We have it in our.
Isolate the guest.
Yeah.
And then go through the sterilization process of the room and backtrack who they've been in contact with and go through all the protocols as established. Here's my new Bible, by the way. If you can't see, and yes, I printed it because I need to refer to it.
Yeah, exactly.
Oh, Jalissa, you did the same thing. Here it is. Had been marked.
And by the way, keep in mind that there are, like, through the whole document, which Bill probably has, there are edits. There's constant change going to it. So even if you print it out, right? Because I saw this was updated a couple of days ago. You just have to kind of check it online because it's a living, breathing document.
And that's what we're doing is we're gearing up and training our teams, and all information is important. Every piece of information is important. Updates and just getting the information to your team's hands. And we're already starting to share it with employees that are not back to work. We have their email addresses, so they're learning at home, different things like that.
And I will add,
Michael Hooper asked a question about when the final guidelines for hotels will be out. Well, you've talked about the new normal. And the hotel section is on page 54. Now we have been attending beach groups, and so here was something that was released by City Manager Morales at a recent meeting. It talks about phase 2 hotels draft plan, phase 2 that the hotels would open, and there's no mention of limiting the number of rooms, even under best practices. So, but I think once again, the basic standard for hotels is in the new normal, page 54, and a city could decide, and we have no timetable for the city of Miami. Wendy and I serve on a group that meets on Fridays, and I think maybe we'll get some more information about the city of Miami. So right now, I mean, in the county, I guess hotels outside of cities would be under this. And I know that 4 or 5 cities had a press conference earlier today. And so they're in some cases going a little slower and just looking to see what happens. But the basic framework for the hotel rules are in the new normal.
And also, Bill, Chris, myself, and a couple of other hoteliers have been working with the city of Miami Beach as well, and they are actually working off of this document as well for the hotel guidelines.
Actually, when they released, I don't know, a few days ago, they actually attached this to their, because and when we looked to print it, it was like 200 and some pages. I said, what? The beaches piece was 4 or 5 pages at the front, but at all times, the new normal, whenever, the new normal is attached basically to everything. And the original new normal, I think 185 pages. I'm a slow reader, so I'm still reading it.
I really think, though, I know we got this question. I really think that that where it's at right now, I don't anticipate any more edits or changes. I think it's all, this is all here.
Well, let me say, because Chris was on, and you were, and others. I mean, these were long meetings, and there was a lot, and obviously medical staff was on all under the leadership of Mayor Gimenez. But this was vetted by large hotels, small hotels, boutique hotels. So the industry had a hand in this. Remember, the other part is the medical. You can't control the medical, but the process was a result of the hotel industry being at the table, large and small brands, non-brands, boutiques, north, south. And so no process is perfect, but I think folks, I mean, these were intense meetings. They weren't necessarily long, but you had to pay attention, right, Chris? This was intense, and Florencia, you were on those, and there were no limits to what you could say, and you said what you felt and what you knew, and the document is a better document, quote unquote, because of your input and participation. Thank you.
No, and I think also it was, I felt like I think there were a couple of days, I think I lost a couple pounds.
It was intense. Intense.
Yeah. So this is a very good question. Are restaurants and hotels permitted to open on 5/27, even though hotels overall are not part of this phase? My understanding is yes, that the restaurants and the hotels can open.
That's my understanding as well.
Mine as well.
And Brian and Jalissa, this is our understanding.
Yes, that is correct.
They don't have to, but
They don't have to. They understood that there were restaurants that had street access and not necessarily serve only a hotel. So therefore, they were allowed to open as well as part of the restaurant rules.
Okay, gosh, I'm getting a lot of questions.
I told you, Wendy. I
love
told
it.
you.
Have there been any discussions around how to police the new normal with respect to adherence by hotel guests? So I'm understanding, then I guess that's also related to maybe not only training for our employees, but probably the guidance for the guests. Like I know we were talking about signage in the rooms, right? I think, Chris, you can probably elaborate on that as well. And I think letting them know before they even arrive, right, to Miami?
We're drafting our webpage with guidelines, which will be launching this week. It's still in development. We've added some to it now. And it is going to be training, but it's also information, signage throughout the hotel, the floor markings that is part of the order. And every staff member will be trained to recognize and encourage the distancing, which is the big component of the order.
That makes sense. Okay, somebody asked about the dates for the training, and that's going to begin on June 1st.
We'll coordinate with the hotels.
Yes. It would be interesting to know if there are any plans for a standardized screening process for associates before entering hotels, especially if there's anyone developing an app that could be easily used without compromising associates' privacy information. So I don't know if anybody has any comments on that.
Wendy, I'll chime in. As far as testing goes,
Yeah,
My understanding is that the county and the local municipalities recommend it, but it's mandatory testing is not enforceable
right,
due to privacy reasons.
right.
So it's up to each hotel company to determine how do they want to approach that. But it's recommended by the municipalities and by the county. Consult with your legal consultant first,
Yeah.
prior to issuing any policy on testing specifically.
Exactly. Good answer, Brian. Let me see. Are you all seeing anything else? I've got, I think, any other questions?
There's some over in the chat section.
Okay. Do you want to read a couple?
Are employees expected to take a temperature check and complete the questionnaire on a daily basis upon clocking in for the shift?
So Julissa, any comments?
Not necessarily. I mean, like just like Brian said, it's a recommendation. It depends what are, some hotels might have strictly rules because they might be under an agreement with a third party or not. Other hotels don't have that. So it depends, again, consult with your legal team to make sure that's something possible. What I can share is that we started with a screening on the temperatures in our hotel, and it has gone very well. But we do not keep a log. We do not keep anything that could hinder or at least touch the employees' privacy, right? What is the objective of taking the temperature? It is not a PR tool. It's just something that we're trying to prevent the spread of a virus. So taking the temperature is just a precaution. And you take the temperature. If it's fine, then you go. If the temperature reaches at 100.4 degrees, then obviously we will ask the associate to go home and keep us posted how their health is going. I think it's important that each hotel develops their own parameters. The document from the county does not state that at what temperature you send someone home or how many times you have to retake the temperature. That's something that you will have to be working very closely with your human resources department and that what works for your hotel.
Perfect. Thank
Well
you.
said, Julissa.
A chat question about this 50% hotel occupancy. There is no 50% hotel room cap. There is none. We've never seen it in writing up until 1:35 today, but there is no hotel room
No.
cap. There
Right.
is no 50%. It does not exist.
So in Miami Beach, there are plenty of properties that will have to manage the new guidelines within a very small physical footprint. For example, their lobbies may not be able to accommodate the 6-foot social distancing rule during peak arrival departure times. Any suggestions in this regard? And I think, Chris, we were talking about that a little while ago. You were going, because I also made reference to, they had, Willard Shepherd had on Friday, did a little tour of the Lenox Hotel, which is a small boutique hotel, similar to Chris's hotels. And they took away a lot of the furniture. They also had what do you call them? Decals on the lobby floor, which Chris was referring to as well, to help guide. Yeah, because the smaller space is actually a little bit more complicated. Don't you agree, Chris? It's because you can't have that many people in there.
I was going to show you the screen. I'm actually approving our decals that we're having printed.
Oh,
They're
good.
lucky I was going
Live.
to try and share it here. I got 2 computers going.
That's
Yes,
great.
the boutique is not challenging. It's just there's not one. They're not all made the same. They're all different. You know, they're lobbies from the 30s. We are anticipating having, you know, your peak check-in time is always 4 to 6 p.m. You have your terraces. It'll be furniture placement. Remove it. Have the spacing outside. You know, you have a lot of great areas where you can have your customers wait, so they're not all congregating at the front desk area. And you know, have a glass of wine set up for them, or a cup of coffee or something, so they are, you know, distanced, but you're that's where the service aspect comes in, and that's what we're famous for here.
Great, good. I have a good question. Can we open pool facilities on 527 along with restaurants? I do not believe so. I haven't heard it. There's no opening on pools yet, right, Bill?
Correct.
Okay. And isn't the new normal temperature 99.5? I thought it was 100.
98.6.
Is Juan around? I wonder if Juan.
Juan?
So, so originally it was about 100, and I think I saw a protocol yesterday that is 99.5.
Okay.
And you know that's basically a little higher than regular temperature, but it's not like a high fever. So it's like an indication of the beginning of a fever. That's what you wanna look at. Remember, the whole point is to capture these cases before they can go into your hotel and spend the whole day of work. So each hotel is going to have to do their own decision making. It is anything that's not required, like in bold letters in the document, it's a recommendation. So each hotel is going to have to make a decision of how to approach that. Not everybody needs to be tested, like it was mentioned before. You were all saying that not everybody's going to be tested. But some hotels might test every employee. I mean, if a hotel has hundreds of employees, it can be challenging. I mean, it can be like every day testing the temperature of everyone.
Exactly. There's a question on residential building pools. Will residential building pools open in the city next week? If so, will hotels be able to sell day passes for pool access as well? If we have a pool area with F&B, can that area be open for service? Yeah, but as we just mentioned, there's no date yet for any pools, residential hotel pools.
Or opening day for hotels. There's a lot of talk.
Yeah, I know. I see that question. Yeah, that's not the question.
For hotels.
There is no opening date yet for the hotels.
And on Miami Beach, it's in the stage 2. You know, restaurants are going to open on the 27th, and so obviously it would be after that. And I think the beach has a finance committee this Friday, so I don't know if there'll be more information then. So we kind of know what you know. Maybe we see it 5 seconds early, but there's a lot of moving parts. I think one of the things they want to see is how does this initial phase roll out? Are people following the rules? Are they doing what they're supposed to do? Washing their hands, facial covering, social distancing. So it's but we the Hotel Association and your bureau, you know, are pushing to get the hotels open as quickly as possible.
Right. As quickly as when it's safe to open.
As safe, yes.
Are bars allowed to reopen so long as there are no customers at the counter and you serve food? So that would be when the restaurants are, right? I would say, right?
The bar's not open.
The bar's not, if there's a bar in the restaurant?
But bars are not in phase 1.
Okay, okay,
No bars are open. No bar in a restaurant is open.
okay. Wow, we're hearing from a lot of our hoteliers. That's good. Is there any specification on the new normal regarding the time frame between the moment a guest checking out and when a maid could be allowed to go inside the room? I don't
think. Not to my knowledge, and it wasn't specified in the document.
Yeah.
I have a comment on that one. So we are aware at this point. I mean, there's a lot of things we don't know about this virus even now, but we are aware that the virus survives in the air for a while. So if a person was actively sick in the room, and you know you're aware of that because of you hear coughing or whatever, you don't want your staff to go in and clean that quickly. And if once they, of course, I'm assuming that you're all going to have the staff wearing masks and gloves whenever they're taking the sheets from the beds, you know, vacuuming the carpet, cleaning the rooms, the bathrooms and all that. So yeah, there is a certain amount of risk if a person was actively sick, coughing inside a room, there may be some virus particles floating around in the room. So you may want to wait a little bit until like an hour or so it settles down. And then the other thing is also when you're vacuuming the carpets, remember that if your vacuums don't have a type of filter that can trap the virus, what you're doing is just basically putting it back in the air. Okay, so that's so important that your staff that is cleaning the rooms is wearing masks and gloves, of course, and then wash their hands afterwards.
Very interesting. Thank you. That's good information. Will hotels with restaurants inside, will they be able to add more seating in the lobby to serve more guests of the restaurant?
Well, they say they can have 50% outside. You can have 50% inside and 50% outside. I don't know what the fine print of outside means, whether a lobby, you couldn't exceed the 100%. But I don't know about the lobby. I don't know what the words are about outside. I guess the lobby is outside the restaurant. I don't know. It seems to me that's something you could do, but I'm not the expert.
This is another favorite question. Any date on when the beaches will be open?
Soon.
We don't know. Yeah, we don't know yet.
Soon.
Could Shelley speak again about the good news related to contact tracing?
Sure. The medical campus is doing training. They have 70 openings right now. If you want, I can give you the website right now, and then Wendy maybe could send it out later.
Yeah.
That'd be okay, Wendy?
That'd be great.
It's www.mdc.edu/upskill, UPSKILL. I hope that answers the question.
Let's see.
We learned from Scott Berman, I don't know, yesterday that PwC, well, there is
They have an app, yeah.
Pardon me?
They have an app.
Yeah, that's what I was going to say. It's called something, but it's apparently not very expensive, and we're taking a look at it now because you know this whatever they call, what is this called? You connecting people. Contact tracing. So I think that's what the app's called, contact tracing. But PwC is using it for their company globally, and Scott said it wasn't expensive, and we're taking a look at it because that's ultimately a secret for each of us to protect ourselves.
Bill, I think also the advantage of having the training, it goes on more information about the contact tracing, not just, doing the app. So if you take this 4-hour training, it gives you a complete background.
I'm going to take the class. Can you get me in, Shelley?
Yeah.
I'll do my best.
Good, thank you.
Me too.
Do we have to install, is it mandatory to install the sneeze guard at the front desk? I don't think it's mandatory on the guidelines. I don't know if you all.
I think it's just one of the recommendations.
Yeah.
Of ideas.
And this is a good question. We did talk about this, that the latest guidelines state that housekeeping daily cleaning is not permitted. I think that's mentioned in the guidelines. Isn't it for housekeeping? That they don't have to clean, they don't go into the room every day while the guest is there. Unless the guest requests, I'm trying to find that info. I don't know if you all remember that one.
Hold on.
I'm looking through right now. I don't believe that it specifies whether daily housekeeping service is eliminated or not.
Yeah.
I think right now it's just basically up to your company policy and how you want to treat it, and if you want to go on on a per request basis or what have you, but there's no content in here that speaks directly to that.
And for everybody that's watching, I think the interesting part about being on this task force and just, you know, being so involved in it is just think about all the different types of wonderful service that you can offer pre-check-in, you know, before the guests arrive at the hotels, to really make them feel, you know, welcome and very safe and comfortable and warm hospitality. And then the more information that they have even before they arrive at the hotel, how the hotel's going to look different, you know, what's changed. I think that's a great way to enhance service too. I think, you know, I mean, I get nervous. I went to the dry cleaner yesterday. I was kind of nervous. You know what I mean? You know what I mean? So it's just like everybody's going to be a little nervous, but it's our role as hospitality, you know, leaders. Oh my gosh, sorry.
I love your dog, Wendy.
Yeah, that's my dog, Charlie. They have to be nice to Charlie.
I love your dog.
Chris, that's homeschooling. Homeschooling.
Anyway, I think you get it. So I think the more the staff knows and you know, and the more you communicate with your guests, especially when it starts, when it's in the beginning, I think that's key for our success, you know, for our guests, to keep our guests happy and safe and comfortable. And then I did see a comment that I wanted to mention when the person was asking about tables in the lobby, you know, from the restaurant. They'd have to have a food license. You know, that space would have to have a food license, which I think is a very good answer. So I wanted to share that with you. When can fitness centers open in residential buildings? We don't know. Disney recently issued a rather blunt COVID-19 disclaimer for their parks. Are any hotels considering this as part of the booking/arrival process? I haven't heard anything.
I have to read what they're asking.
Yeah, I'm not sure what.
I just see what Disney is stating. We are adding a page to ours. I'll speak for us, and I'm sure Jalissa will have a page of protocols that we are doing, so our guests that are interested in booking know what we're doing.
Yeah.
That's what they're referring to. I haven't seen the Disney page.
No, I haven't either. Okay, so some hotels are making guests sign waivers at check-in. Let's see, what else?
See here, stayover service is not allowed. Service is at checkout. I'm looking.
Yeah.
Service on checkout only. Thank you, Mary.
Let's see, anything else? Any comments from the panel?
I
have a good question.
Sorry.
Your health department. Are they going to conduct inspections, Juan? Do you know?
So the agency that regulates hotels is another state agency called Department of Business and Professional Regulation. We work very closely with them. The health department works very closely with them, and in fact, we accompany them sometimes when there's outbreaks and things of that nature. They will still be conducting inspections, but you know, their inspections usually are mostly of the restaurant itself. They conduct inspections of the hotel rooms and things like that when there's complaints, like for example, people call about bed bugs or that kind of thing. So we're going to be working very closely with them. One of the ideas is that if a hotel has an issue or they have identified cases in the hotel, to let the agencies know, so to protect also the inspectors, because we want to make sure that, you know, our inspectors are safe. One of the things that I wanted to comment on is, like I mentioned before, that each hotel is different. There's different sizes. There's different ways that they operate. So, you know, a lot of the things that are questions that I've been hearing are going to depend if they're not required by the data-driven recommendations, because, you know, this is one of the things I wanted to mention. the recommendations are going to be data driven. So if we see an increase in cases, definitely we're going to slow down the process of opening. If we see that the cases start going down in the summer, which we're hoping strongly that that happens, then it'll be sped up, and these things that you see, these restrictions, are going to be going lower and lower until we go to a new normal. But yeah, the agencies are going to be working very closely. Most of the inspections are going to occur in restaurants within the hotels, and I'm not sure if I heard it earlier that those are going to be opening probably at the same time as the hotel, because I guess the residents are going to need to eat, right?
It's up to the hotel operator, right? If they want to open, like if they have more than one restaurant, I think it's up to them.
Right, and I read somewhere that food service in the rooms, delivery of food, it was going to be allowed. So I guess at least the kitchens will be open, I guess, if there's no sitting in the hotels. But again, all these things, I just wanted to stress that all these things are going to be data driven,
right.
And we're getting results on a daily basis. And as the results come in, we'll get a better picture if this curve is being flattened or not.
And another question for you, Juan. Let's suppose a positive case is traced and a specific hotel or restaurant is involved as having been visited by this person. Do the protocols may include any kind of closure of the specific hotel room floor or even building?
So it all depends on each individual case. So like, for example, if you have an outbreak of cases in a floor, you're definitely going to want to close that floor and disinfect it, and these closures may not necessarily be for a long period of time. It may be only for as long as the time to clean and disinfect the rooms. And then, of course, the exposed staff may have to go on quarantine. If there have been staff, for example, that was found not to be wearing masks and they were exposed to customers, then that's a different situation altogether. So they may have to go in a 14-day quarantine. But each of these situations is going to be dealt on an individual basis. We're hoping that your managers will notify us so we can make those determinations. We immediately do the contact tracing and try to find out who would be the really at-risk people. Because in a hotel that has 500 rooms or 1,000 rooms or something, if there was one room on the 8th floor with one person, the risk there has to be evaluated, and it's not going to be a closure for the whole hotel. Is my understanding.
Thank you, Juan. Now, are you going to have will there be a hotline or will it just be, what do you, once these hotels and businesses start opening up?
So we have a web page that is available. It's I think it's floridahealthcovid19.gov, I think, and that web page is got a lot of information. It's got links to CDC. It's got links to a phone number, like a 24-hour phone number that you can call and ask questions. We also have emails that we get. I've been helping with some of those where people ask questions, to our lines, and then we reply by email, with details. So there's many ways you can contact the health department. And like I said, we have zillions of reportable diseases that we deal with, but this is our focus right now. We're focusing on this because we believe it's very, very important. Not to bring fear, because fear is the root of all evil. It's just people need to be common sense. That's the main thing. Common sense, no fear. I mean, fear it just brings you down the wrong path. You want to be concerned and cautious and common sense. That's all it is. So once we know that it's safe to do things, the things will be able to be done. In the meantime, we still can do things. It's just, there's going to be certain restrictions that are just common sense to do to prevent.
Absolutely. Yeah, absolutely. And it's so important that the guests and the employees are treated, in that same boat of being, they want to feel safe, they want to feel comfortable, they want to feel, that they're, in the best hands. And I think that's really, that's what makes our hoteliers so wonderful, because they're thinking about everything. They're thinking about the employees, their families, the guests, the environment around them. And that's why I really think this being part of this task force has been really, really very, very great to have so many hoteliers on it. Also wanted to
Wendy,
mention.
question.
Yeah.
Question. I'm not sure I fully understand. I heard it a second ago. Is room service permitted? Yes or no?
It's suspended.
Huh?
It's suspended. I thought it was, but I didn't see it. And one of our hoteliers just sent a note that the room service is suspended.
Okay, because I thought, okay.
Thank you, Jimmy.
The room service is restricted, so it says page 61 actually.
61?
But there is the option of delivery, not going into the room anymore, and not obviously to prevent anything of the contact, right, with employee and the guests.
Right.
It could be delivered to the room, just drop off outside for the convenience of the guests.
Delivery only to door with PPE, yeah. And a lot of hotels have been doing that anyhow.
Correct.
So I have another question that I think has been on everybody's minds, and I've been kind of fascinated with the whole event, meeting, banquet department, since that's how I grew up in hotels, working at the Biltmore Hotel in the Mayfair and the Grand Bay, and Open Delano as food and beverage. There are guidelines in the document referring to banquets, and while it's not very detailed, it's really all about your space and adhering to the guidelines of the social distancing. How you space out the guests at the tables, how you set up the wedding ceremony, how you have to be, and Juan, feel free to chime in, because I think it's going to be a very creative opportunity for many of our catering and convention services employees to be very creative, but they have to make sure that they're following the guidelines as per social distancing, and also the food service would be kind of the same. No buffets. I think you all know
that's what I was going to say.
Yeah.
I read somewhere.
Yeah.
I read somewhere that the buffets is going to be the limiting thing. That you're going to have the table spread out a little bit more, and you're also going to have
the chairs.
The chairs, yeah. And then it's going to be table service rather than buffet, which I love buffets, but sadly that's not going to happen.
Juan, there will be grab and goes. So grab and goes.
Yeah, you can do that too. Yeah.
Those are fun. So I think that will be nice. But I know there's a lot of concern for social events, corporate events. We're actually going to do a webinar probably in the next 10 days for catering, banquets, and events, because there's a lot of concern. I know some weddings are canceling or trying to shrink down and whatnot. So we really want to be able to address that according to the guidelines. Anything else? Let's see if I have anything else. Wow, this is great, you all. You got very timely. How should we handle airport shuttles? Is there a minimum of guests allowed to be transferred? I think the shuttles, and Bill, you can chime in. I think the shuttles, they're always operating, even if it's just 2 people on the shuttle, right?
Yeah, I guess we'd have to wear a facial covering.
Yeah.
I think that's
And
also
so
social distancing is always a and I think if it's me, I mean, if it's my baggage, my luggage, I'm going to make sure I wipe it off and keep it clean. It's all about the touch points. Every single touch point, you got to assume every other person has it.
Absolutely.
Every other person has it. So they have to assume you have it. So it's, I think the transportation, I think they'll space out folks, and So they'll be learning too. I mean, they'll have to have facial coverings and they'll have to clean the vehicle. Although I don't think I've seen anything. There wasn't a transportation component. I mean, there were 15 of these industry groups.
There was nothing related to like maybe the public, like buses or anything, or no? I have a good question for Juan. What if a guest does not want to wear a mask, a facial covering?
Well, that's something that we've been asked a lot. Many of the places that are open and people complaining that people are not following, in some places, not all, but some places people are not following the recommendations. So this is something that you're going to have to deal at the hotel level. You know, your staff are going to have to be very tactfully tell the customers, you know, this is a very important thing for you to do. And then, of course, if they completely refuse, you know, there are things that you can do. I heard earlier someone mention that when the person makes the reservation, you should have like a list of disclaimers that you're going to say, you know, remember that you're moving to a hotel in Miami that has these restrictions. We're expecting the guests to behave in a certain way and that sort of thing. So I think overall most people are gonna be okay with this because, you know, they understand that this is this is good, that they're still able to.
This is to protect the guest.
Right.
This rule that we're imposing on you is to protect you.
Right, and that's a good line. You can say we're not only protecting our staff, we're not only protecting the other guests, we're also protecting you, because, you know, for all we know, you're healthy and some other guests might not be. So, you know, again, this is something that I see over time has developed as people are now more comfortable going to supermarkets with masks. You know, I come to the office only once a week and I come with a mask. So you know, it's something that takes some time to get used to it. But I think people eventually, now they have masks that are fashion statements that have different things, logos and things like that. So there you go. I like that one. The Marlins, right?
Yes, sir.
Yeah. So you know, this is the kind of thing that people eventually will realize that it's a new way of behaving, and I think overall you're not going to have that many problems. But every once in a while there's going to be a guest that is going to be a problem, and at the hotel level I think should be taken care of.
Yeah.
Of course, if the person gets completely unruly, that's what the police is for. Miami Beach Police, Miami Dade County Police, that sort of thing. I mean, if the person really goes way out into danger zone, but you know, when a person is not wearing a mask, you can just tell the person, you know, hey, you know, remember you need to wear a mask here in the elevators and, you know, in the lobbies and that sort of thing.
That's great. Well, this has been really interesting. I think we've all learned something as well, and I want to thank the audience. You had great questions. I know we didn't get to completely all of them, but we can continue. We'll probably have to do a part 2. And I did want to ask our panelists if you have any comments or anything that you would like to share before we bid farewell.
I think the only thing is, and we saw this during this session, a bunch of folks have this document in front of them, and on the chat, they actually went right to the page and said, the answer's here. Bill, if you'd have read it, you'd known it. So I think I want to thank our colleagues for paying attention to the document and helping all of us. Nobody knows everything. And sometimes we think something says something and it doesn't. So it's, I think, thank you for all of us reading it. Remember, there's an index. There's an index. So you don't necessarily have to read the whole thing. Page 54, hotels and accommodations. Page 53, restaurants. And so you have a very savvy group of participants here because they're typing in what page to look at. Bravo.
Well, we're all in this together. So if I don't know anything, I would depend on, we're all here to help each other. You can get my cell phone, my email. like Wendy said, she's up at 1 o'clock in the morning. We're all pushing through to get back to our business, and I think with everyone working together, and with Shelley and Juan guiding us, we can do just that. So it was a pleasure seeing everybody, and thank you for joining us.
Thank you.
I
for
think,
saying that.
Wendy,
As I
we
said,
should be all very proud that we were involved in this document. I think it's the first time since I remember that, a lot of hotels, small, big hotels were part of that document, that we feel comfortable when they release it. It was exactly what we discussed with Mayor Gimenez and his team. Of course, if you have a brand, in our case, we have Marriott, they came up with their guidelines, but these are the basics. We should all follow this document. And if you want to do more, but, keep it simple, try to refer to the pages and, implement the things that are there, and we will be able to reopen soon, being consistency. That's what is important with the training also.
That's absolutely. We're looking forward to that training, Shelley.
Oh,
Yes.
thank you. And thank you.
Oh,
for
yes,
letting me
yes,
talk
yes,
about
definitely.
MDC Protects.
Thanks,
MD.
Jen. Thank you.
Thank you.
Melissa, thank you.
Thank you. Thank you, everyone.
Wendy, Fahima, thank you.
And
Thank
Juan, great. Great having you,
Thank you
Juan.
all. And if you have any questions, health related questions, go to that website that I mentioned, and also, you can call that number. We'll be here to help everyone. Okay.
We're gonna come
Thank
see
you,
you,
Juan.
man. We know you're the expert. We're gonna see you.
Yes.
Thank you.
Still in Miami shines.
There you go. Thank you, Shelley.
That's it, Bill. That's you.
Thank you.
Everyone.
Thanks, everyone. Have a
Thank
great
you.
rest of the afternoon.
Thank you.